So this course is going to provide an overview of program evaluation. So it's an emphasis on evaluation and research methods for the purpose um, of understanding the effectiveness and efficiency of programs. So it's a really good thing to learn as students, as people who are interested in research and evaluation, and then also for people who are involved as practitioners and even as policymakers. And so our first session is on why measuring outcomes is important. So this is just very brief introduction to monitoring and evaluation in programs. And so we're going to talk just briefly about why measuring outcomes is important, and then looking at some models for evidence-based policy and evidence-based practice. So yeah, as stated, this course provides an overview of research methodology for program evaluation, and it's especially suited for those who are interested in M&E, policy and program design and evaluation, and social science research methods. This is the outline of the course. So there are 12 lectures or sessions, and we're going to be moving from sort of introduction and theory and framework to actually then how to implement evaluations and monitoring. So today, obviously, just introduction, why measuring outcomes is important, then moving on to looking at different frameworks for evaluation and designing evaluations, looking at theory-based evaluation as something that we can use to sort of ground evaluation methods and research in theories and program theories. And then looking at data collection and analysis, mostly we're going to be looking at qualitative data, although a little bit into quantitative, but mostly looking at qualitative data. We'll also look at logic models, ethical issues in research, which is particularly an issue in our field of work, right? When we work with vulnerable populations and with youth, we want to follow the right ethical standards for research. And then looking at systematic reviews and how to conduct critical appraisal. And so that was actually a workshop that we did at the center last week, is how to conduct systematic reviews and how to synthesize and collate evidence from an entire field of study. And then we're going to be looking at how to apply research to evidence-based programming, which is sort of the culmination and how to actually use monitoring and evaluation to benefit and improve programs. We'll start out with just an initial question. Why do you think measuring outcomes is important?
I think if we don't want to generate outcomes, then it doesn't make worth doing project or any activities. So, so outcomes are so important in projects, and if we cannot measure them, then we don't know whether we are progressing or we are achieving our goals, or whatever we are doing. Is it worth investing money and effort in it or not? So just to evaluate ourselves, just to evaluate the money and effort and all whatever we are doing, evaluation of outcome or measuring of outcome is so critical in projects, I think.
Yeah, exactly. Making sure that we know what's happening in the programs, and like you said, kind of understanding whether our programs are worth implementing in the first place, which is, I mean, it's kind of a scary question to ask yourself, especially if, say you started an organization and you've been running programs for, 5 or 10 years, and then you find out eventually that your programs are either not effective or they're not accomplishing what you thought you were accomplishing. So how do you sort of pivot from that to either make it effective or have to tell all your donors and supporters that actually, we haven't been accomplishing what we thought we were accomplishing. And yeah. So it's important for a variety of reasons. Measuring outcomes is important to make programs more effective and sustainable, for donor reporting, for promoting an evidence-based approach, and then also for knowledge creation. So we want to continually shape our own strategies and projects so that they become more effective. And inherent in that is sort of the assumption that the use of evidence will make our programs more effective and sustainable. Now, obviously, it depends on what kind of evidence you use and where you find your evidence and how you analyze it, and then how you implement program changes based on your findings. But overall, one goal of using evidence and of evaluation is to just make our programs and our strategies more effective and more efficient. And throughout the course, we'll be looking at different methods and strategies for evaluation that actually focus on different kinds of outcomes as well. So different, for instance, process evaluations might look at more what exactly happens in a project, what are the activities and mechanisms that produce certain outcomes, whereas you could use an impact evaluation to just look simply uh, at what a project produces and what are the results. We want to be able to show our donors and supporters, as well as also board members and other people in the program, international networks and partners. We want to be able to communicate what's going on in our programs. And given today, the field of international development and M&E practices worldwide, is that monitoring and evaluation is increasingly important. It's something that really sets you apart from other organizations in terms of your ability to effectively understand the data that you're producing and communicate it to different stakeholders. Thirdly, promote an evidence-based approach. So demonstrate that projects are based on proven strategies, in the case of Global Family, for prevention, intervention, and aftercare. And we'll be looking at what evidence-based practice and policy actually means and kind of where those terms came from originally. But overall, promoting an evidence-based approach in whatever field that you might work in, whether it be working with refugees or working in a training center or working with children and families. And then finally, knowledge creation. This might be a secondary goal. For instance, every organization, every nonprofit has a particular mission and vision that it's working towards. But a secondary goal could be to create knowledge in a field that might be able to benefit others, might be able to benefit the design and implementation of other programs in a similar field, and therefore sort of develop and contribute to this wider body of knowledge and body of evidence around a particular topic. So what is monitoring and evaluation, M&E? So monitoring is the collection of information about a project's activities. So it keeps track of inputs and outputs of a program. These can include activities or so-called mechanisms of change within a project, reports, finances, and even supplies, and even physical inputs that are used to support and implement a program. And then evaluation takes all of that data, the data of what's being put into a project, what happens in a project, and what happens as a result of a project. And it asks whether the project is achieving what it set out to do in the beginning, and then also whether that's making a difference. And so evaluation often seeks to understand how and why an intervention works. And it keeps track of key objectives or key outcomes related to a project's objectives. Evaluation takes all of that information and then asks, are we achieving what the project had set out to do originally, what the project's mission and vision is, or rather are we achieving what we're looking for in a specific research question per se. So that's what M&E is, and it provides information on how well an intervention is doing, whether it's achieving its aims and objectives. It provides an important part of accountability to donors, as well as guidance on future intervention activities. It also helps to be accountable and responsible within an organization. It helps to better manage risks and opportunities, make informed decisions, and learn from experience. Okay, so we're going to look now at what evidence-based practice and policy means. And so again, when we implement programs that affect people's lives, especially vulnerable people and people at risk, especially children, it's our duty to make sure that we aren't causing harm to those people. And so, evaluation can help us understand not only whether our programs are effective, but also assess whether our programs are causing harm, even unintentional harm, to the individuals that we serve, as well as to the wider community and to our partners as well. So evidence-based practice is an important paradigm in the field of evaluation, and it's kind of the sort of the larger theoretical body of evidence out of which evaluation comes or stems. And so before we look at evidence-based practice, we actually need to look at evidence-based policy. And so evidence-based policy, it's a term that was sort of started out of the evidence-based medicine movement, which arose out of a desire to make sure that healthcare and the administration of health systems and health policy was being developed in the consideration of evidence and knowledge, and actually making sure that we're producing good healthcare. And so the evidence-based medicine movement gave rise to a movement called evidence-based policy, which is the same thing, just sort of stretched out over a bunch of different domains. So no longer looking at healthcare, but also wanting to make sure that policies around welfare and transportation and fiscal procedures and any kind of policy, particularly social policies, but it could refer to any type of policy. And so making sure that policies are evidence-based, or at least trying to influence policies with the availability of evidence. What researchers found in this process is that policymakers, and likewise practitioners, but policymakers don't necessarily just read a systematic review, or they don't just kind of look at data and then based on that alone make decisions about their campaigns and the policies that they promote and create. There are a lot of different ways in which policy is formed. And so some of these incentives that policymakers face include political and electoral incentives, economic concerns, personal experience, and then expert opinion as well. So to say that a policymaker or practitioner looks at data, say, data that we might propose or provide, and use just that data to change policy or to write policy would be a really simplified and very inaccurate way of understanding how policy and practice actually works, because there are a lot of different incentives and factors within the environment of policy making that affect how policy is formed. And so most proponents of evidence-based policy argue that there are reasons why research has minimal influence on policy. And most of that evidence centers around these competing interests that policymakers are faced with. But many researchers have found that policymakers prefer looking at data that is available and that refers to their local areas, so making evidence as applicable and accessible as possible. That brings us to the question of how we can promote evidence-based policy in light of these competing interests. And so researchers have taken up that question. In one study by Kearney and Oliver in 2017, they suggest that researchers can be most effective when combining the principles of evidence and governance. And so they talk about how value-driven arguments can be actually just as persuasive to policymakers, if not more persuasive than evidence itself. And therefore, what researchers and practitioners as well can do when they're trying to advocate for better policies or different policies is actually package the evidence that they're proposing and reporting alongside different factors and motives that the policymaker might be constrained by or influenced by, including social, political, and ideological motives and predispositions. So in other words, not just sort of proposing and presenting, this is the evidence that we have and you have to do something with it, but understanding that there are all these things in the environment which impact the uptake of evidence. And so packaging the evidence in a way that policymakers understand is important to their constituency and their career, and in a way that makes sense also in light of the current political and economic environment in which they're working. Another study, this is a bit older study in 2008 by Head, they argue that rather than convincing one base for evidence, it's more useful to identify three types of evidence that can inform policy, namely systematic or scientific research, practical experience, and political judgment. So not only relying on published and peer-reviewed literature or studies, but actually combining that with the practical experience and political judgment of the researcher and the policymaker, for instance. Other studies that have looked at how we can more effectively facilitate the uptake of evidence in policymaking includes so these studies, so pursuing the systematic examination of research, which more holistically identifies past lessons and experiences. In other words, not just using research from one time period or research that is segmented, but looking at the entire collection of research on a particular issue. Using research that targets multiple stages of the policy process, for instance, to inform agenda setting, examining alternatives, and evaluating outcomes. So looking at stages of how policy is formed and created and proposed and then adopted and then implemented and integrated and communicated, and looking at research that can inform or contribute to, I suppose, different parts of that process. And then finally, evaluation of policies that considers political considerations and the need to identify and isolate effects of pilot programs from exogenous factors. So in other words, trying to figure out where outcomes come from and looking at which programs produce those outcomes and whether those outcomes are produced or sort of facilitated by other confounding factors. And so evidence-based practice is the same thing as evidence-based policy, but just in the context of the implementation of a program or an intervention. So it's using evidence to inform the development, the implementation, and the use of actual programs and projects. And so this definition, I really like this definition of evidence-based practice. It is the conscientious, explicit, and judicious use of best currently available evidence integrated with client values and professional expertise in making decisions about the care of individuals. And so there are many models for evidence-based practice. And by model, I mean framework or stages or steps in which evidence-based practice can be implemented in an organization and in a program. And so these include the Iowa model, the Stettler model, the Ottawa model of research use, the Promoting Action on Research Implementation in Health Services framework, ACE, Academic Center for Evidence-Based Practice, STAR model of knowledge transformation, Advanced Research and Clinical Practice through Close Collaboration, Johns Hopkins Nursing Evidence-Based Practice Model, and the Knowledge to Action KTA Process Framework. And so there are many models for EBP. This is just one list of them. And it's worth noting too that evidence-based practice, while it can be applied to any discipline or type of organization, it's really many of its proponents and many of its researchers come from the healthcare field, which if you work in the field of modern slavery and human trafficking is not necessarily irrelevant. Human trafficking and modern slavery is very much so a public health issue. And many of the programs that work with victims of modern slavery use healthcare interventions and partner with healthcare organizations and practices. So while these models can be applied to any kind of program, they are sort of specifically written for healthcare, although that doesn't necessarily mean that we can't use it in other kinds of programs like our own. I'm just going to look a little bit into two of these frameworks to sort of describe how they propose that evidence can be used in a program. And so ACE, Academic Center for Evidence-Based Practice, STAR model of knowledge transformation, what a name. So this model has 5 major stages that depict forms of knowledge in relative sequence. So you kind of go through each stage of the use and the dissemination of knowledge. They start out with stage 1, discovery. This stage involves searching for new knowledge found in traditional quantitative and qualitative methodologies. So just the search for knowledge. Evidence summary. In this stage, we synthesize research into a meaningful statement of evidence for a given topic. This is a knowledge generating stage which occurs simultaneously with new findings that may arise from the synthesis. So after collecting data, we then synthesize and understand the data that exists. Stage 3 is translation. So the aim of translation is to provide clinicians or practitioners with a practice document, for instance, guidelines or frameworks or recommendations derived from that synthesis and summation of the research findings. So once we look for the research, we synthesize the research, and then we determine how that research is applicable to our own work, and we determine or we develop sort of a list of things that we can then directly apply to our field of work based on that research. Stage 4 is integration. Practitioner and healthcare organization, or just organization, practices are changed through formal and informal channels. And so that refers to the integration of evidence and knowledge within an organization, and really the use of evidence-based practices in the day-to-day operation of an organization or program. And then evaluation, finally. An array of evidence-based practice outcomes are evaluated on impact, quality, and satisfaction. And so not only do we want to use evidence in our programs, but we want to evaluate our programs, as well as whether the implementation of EBP in a program actually resulted in positive outcomes, or just to determine what effect that had on the operation and the sustainability of the program. The next framework that we'll be looking at is the Knowledge to Action framework, or KTA process framework. So here we have 7 steps for evidence-based practice. And so you begin by identifying the problems that need to be addressed. And so I actually think that this isn't necessarily a mandatory step, because we want to be using and implementing evidence at all stages of the development of a program, not just when we might need, or not just when we discover a need or when we discover a problem. Evidence-based practice should be a continuous aspect of the running of a program, not just when we, when we discover, oh, there's this big problem and we need to figure out how to solve it. Step 2, adapt the knowledge used to a local context. So say you use evidence from a different organization, from a different country, from a different culture even, or language, adapting that knowledge to the context and the program that you're working in. Identify barriers to the use of knowledge. So you might observe, or through your expertise and experience, you might know that there are certain barriers to the use of evidence in a program. So say there's a lack of time to devote to understanding evidence, there's a lack of expertise amongst the staff. And so the third step is to really identify the barriers to the use of that knowledge and trying to mitigate and lessen those barriers. Finally, select, adapt, and implement interventions. So actually implement changes or new interventions that are consistent with the evidence that you found. Monitor the use of implanted knowledge, evaluate outcomes related to knowledge use, and then finally sustain appropriate knowledge use. So the idea behind step 7 is that, again, evidence-based practice isn't just a one-time step that we take. We hopefully the uptake of evidence will sustain the creation of knowledge throughout the life course of a project. And also just make sure that, or try to support staff in implementing evidence-based practices on an ongoing basis. So there are various barriers to using evidence-based practice. Not all organizations are perfectly funded. Not all staff members are perfectly trained in how to use evidence. And so there are a lot of barriers that have been identified by literature, by researchers, in using evidence in organizations and in programs. And some of those barriers include lack of financial resources, lack of human resources, implementation difficulty, time constraints, knowledge gaps. So there might be an inadequate training of staff, or there might be lack of understanding of the goals of implementation of M&E, a lack of teamwork and organizational support, perhaps even a distrust of the evidence base. So researchers have found that looking at case studies of organizations that have started implementing evidence-based practice methods and using evidence in their programs that staff or people within the organization have sort of distrusted evidence that they're given. Reluctance to change is another barrier. Lack of time to understand and inquire into research, which is a really valid point. We might not always have, hours of our week to spend on looking for new research and looking for new evidence. And finally, research and evidence is not readily available. So even though there might be research and evidence on a particular topic, you might not be able to access that information. And so what are the facilitators of EBP? So interestingly, these studies found that when staff perceived that evidence-based practice was an effective approach, that would actually facilitated the uptake of evidence. Organizational support and prioritization. We not only want to implement EBP, but we want to support other people in our organization to do that effectively and to promote and create a culture within an organization that utilizes and prioritizes evidence. Supportive leadership in EBP, support and coordination among staff as well. Having adequate resources and time was a facilitator, and also being able to observe and understand outcomes from the implementation of findings as the project went along. Good communication and information flow was another facilitator. Training on research and evidence use, as well as continuing education. And then also the availability of resources. So this is from a study looking at the implementation of evidence-based practice with nurses. So I really like the way that they sort of split this up into planning, early implementation, and then implementation and sustainability. So they looked at different stages in the implementation of evidence-based practice and listed the facilitators and barriers at each stage. So in the planning stage, which involved initial engagement and collaborative working, they noted that facilitators to evidence uptake were evidence that the innovation or the approach or the strategy was easy to use and cost effective, and then also the ownership, flexibility, and the autonomy to adapt the innovation. So if your organization tries to adopt an EBP framework or method of data collection, for instance, from a different organization, being able to take ownership over that process and to adapt that to the local needs of your team and your issue, that's a very important thing. Barriers included organizational infrastructure and changes, and then also practical issues related to research and implementation. In the early implementation phase, which in this study involved training, trialing, and the innovation, and then allocation of roles in relation to the intervention, facilitators included, again, ownership and flexibility over the approach, relationships between the nurses and their patients, pre-existing trusting nurse-patient relations, and then also improved working relations. Barriers at this stage included the uncertainty around the innovation itself and nurses, or for our purposes, staff being inadequately skilled, perhaps to look at and analyze data. And then also difficulty connecting outcomes and improvement and negative impact on patient care. So not being able to understand or to see clearly how the implementation of this new approach to the use of evidence is actually producing outcomes within the organization and for the patients. And then in the final stage that they identified, implementation and sustainability, which in the study included support strategies and regular contact. Facilitators of EBP were contribute to professional development and meeting the organizational goals, improving working relations, and then a stable organization as well. Then barriers were nurses or their colleagues considering the innovation to be incompatible with their role, and then also organizational infrastructure and changes that provided, or rather served as barriers to EBP within the organization. All right, so that is the end of the first session, just introduction to why measuring outcomes is important and some theories and some frameworks for how evidence-based practice can take place.